depending on exactly what the problem is, sometimes we have one option to go to the cath lab, or on the flip side, only the option to go to surgery. Now, if all other things are equal, the risks, the benefits, and the expected durability of any intervention, then it's always better to go to the cath lab where things can be done with a tiny puncture by a needle in the groin rather than a big incision going back into the chest, especially if it's a redo operation. But most of the time, it's not quite that straightforward. There are a multitude of factors that go into that decision, and we discuss that in our conferences. One of them includes whether there are coexisting heart lesions that are not amenable to a catheter-based solution. So if you've got two problems at the same time and both need to be addressed and only one can be fixed in the cath lab, oftentimes if we perceive that both are important enough to fix now, that's a situation in which we might recommend surgery for both of them, since we can take care of both of them at the same time with one intervention, rather than just fixing the one in the cath lab and then letting the other one remain unrepaired for the time being. And so it really depends on the unique situation and the relative contribution that the multiple issues might be having on your symptoms and your overall risk of complications in the future.